Well, hello, it's Bruce Williams again, and today I would like to present the final lecture in my series on the selected gross pathology of avian species. Part 11 is going to cover the reproductive system. Before I begin, I want to thank my friends and colleagues, especially the amazing Dr. Rob Porter, an unfortunate Cleveland Indians baseball fan, but an all-around fantastic guy who's done tremendous amounts for the veterinary profession in terms of making available amazing images and write-ups of his adventures in poultry pathology. A man of great enthusiasm, I stand in his shadow. These lectures are a very pale comparison to the ones that he produces. So if you ever have a chance to attend a lecture through the Foundation or anywhere else by Dr. Rob Porter, please go. Okay, and all the other great people on this slide who have provided images over the years, thank you so much. Okay, a source of great confusion to me and to a lot of people is the reproductive tract of the hen and where eggs come from. We're not going to talk today about the reproductive tract of the male bird. Sorry, you're just not that important in the great scheme of things, except for maybe keeping poultry practices going, but we're really interested in eggs. When we look at the reproductive tract of the hen, we have the ovary, and all of this, with all the different divisions, which is sort of like a factory for making eggs, is called the oviduct. When we talk about salpingitis, as we will later on in the lecture, salpingitis starts here, can end anywhere before the vagina. This is all oviduct, and any part of inflammation can be referred to as salpingitis. Another thing to remember is that this is the left ovary and oviduct of the bird. Only one is functional. The right side generally is vestigial, only one works, and in very rare cases of damage to the left ovary, the right ovary may kick in and become functional again. You can see developing oaks. This would be the yolk of the eggs right here. And this is as many eggs as this bird is going to lay in its lifetime. Just like mammals, you're born with all the ovary you're ever going to use, and probably a whole lot more. Here's an old but a great picture from Dick Chakowski at the University of Connecticut, showing the ovary of the bird, the developing eggs, and then there's an area right here, if you can see that. This is the stigma, and the stigma is the place when this ovum ovulates. It's going to split right here. It's also called a suture line. It's going to split here for ovulation. Okay, so when this egg splits at the stigma here, it's going to be expelled into the area right adjacent to the first part of the oviduct, the infundibulum. It's going to sit there. The infundibulum is a muscular part of the oviduct, which will sort of reach out and grab that yolk. It's going to stay here for about 15 minutes or so. And if fertilization is going to occur, it's going to occur down here, or way up here. Now, where does the sperm come, you say, or come from? Well, obviously it's going to come from outside through the vent, but there is an area right here in between the vagina and the shell gland, which is known as the sperm host glands, where hens can keep viable sperm for up to 2 weeks. And then the sperm is going to travel all the way up the oviduct and fertilize the egg before anything else occurs down here in what I call the egg factory. The next and the longest part of the oviduct is referred to as the magnum down here. It's also the widest spot, and the fertilized or unfertilized yolk will travel down through the magnum, and this is where the egg white is produced. Over the next hour or so, once it reaches the isthmus, the inner and outer egg membranes are formed within this region. As you can imagine, once it leaves the isthmus, it goes to a place called the shell gland, and it will stay here for another 20 hours. This is where it spends most of its time, and this is where the shell is applied. The shell is made of calcium carbonate, as we've talked about before, and the hen's body will mobilize 8 to 10% of body calcium from its bone to make the egg's shell. This is why we talked in the lecture on musculoskeletal how important it is to increase the calcium ration to up to calcium in the ration up to 3.5% to ensure that the layer does not mobilize too much bone or calcium from her bones to allow them to become weak, brittle, fracture easily, or go into a condition known as cage paralysis. That's a tremendous amount of calcium that she mobilizes to put the shell on the egg. Finally, the fully formed egg will move into the vagina, which is a muscular part, does not contribute anything to the egg, but does prepare the egg for oviposition or laying. Interestingly, eggs, as we know, have a small and a large part, or a large end, and the egg, as it's made and travels down through the oviduct, goes small end first, and within the vagina it turns around and the eggs are laid wide end first. Well, I hope that sort of clears up a little of the mystery. It's a gross oversimplification, as so much of what I give you is, but I hope it's a little helpful as to understanding how the eggs you eat at breakfast every morning are made. Okay, so let's look at some things that can go wrong. Here's a big water-filled thin membrane bag, which you can see within a number of avian species, and this is that right oviduct. It's cystic. The condition is known as cystic right oviduct. Usually doesn't cause much of a problem, and in this vestigial right oviduct you will commonly find a degree of fluid accumulation in hens. They can be almost microscopic to up to 20 centimeters in diameter. They've been associated in some flocks with outbreaks of infectious bronchitis, but they don't seem to cause any significant effects on production. Here's another picture of one. Head of the bird's this way. There's just the bottom of the bird, and it's just easier, I guess, to put it out here. And this picture was taken by Dr. Guillermo Ramoldi at the Clemson University Diagnostic Center. Cystic right oviduct. Eggbound animals. Okay, there are a lot of problems that can cause egg binding in birds. This one being a parakeet. It's rarely seen in poultry. It's not a common occurrence, but it can. And just about everything has been attributed to this, probably seen in young, immature birds. You can see in very old, obese birds as well. There's a range of dietary things which has been attributed to cause, not maybe cause, but to contribute to egg binding, including calcium deficiency, excess protein in the diet. Obviously, genetics is probably going to play a factor. And concurrent infections of the oviduct can also all contribute to egg binding in birds. When we talked about infections of the oviduct, they're most likely going to be bacterial. And colibacillosis, as we've seen in a number of cases, cholesepticemia, is probably the most common cause of salpingitis or inflammation of the oviduct in laying hens. And you'll see this, large exudate-filled oviduct. Obviously, it's not going to be facilitating the passage of eggs at this point. Pasteurella or salmonella infections can also contribute to salpingitis, and most of these cases are diagnosed at autopsy. Here's a slightly more advanced case of salpingitis. You can see that the oviduct has turned sort of a dark, very congested look to it, and there's some areas where you have accumulation of inspissated exudate, albumin, and possibly yolk material throughout. And now we're getting into the point where it's going to rupture. The animal will develop egg yolk peritonitis. And this is sort of characterized by fibrin and this albumin-like material. It has a sort of cooked appearance within the abdominal viscera. Here's a great picture of egg yolk peritonitis by Dr. Sakaguchi from Louisiana State University. These animals will develop peritonitis. This is not just albumin and yolk. It's all of that bacteria which has now spread into the abdominal cavity and often will result in sudden death in these birds. Obviously, if this is happening a lot, this material should be cultured, probably should be cultured anyhow, and then you may be able to take some preventive steps by adding antibiotics into the water. Not really going to be extremely helpful when the condition of peritonitis has already occurred, but might help to decrease future cases. I like these pictures of oviduct inflammation. Looks like recurrent bouts of inflammation over and over again with this sort of lamellated appearance to the infection here. Once again, E. coli, probably top of the pops. Always, one of the most common bacterial infections in birds as well. Here's one that's a little more chronic. If it's a duck, you want to think about something like Rhinorella, which would be the duck version of Pasteurella. So just these recurrent lamellations of inflammation and scarring. Probably a couple of eggs were able to make their way down, and then eventually one got stuck, ruptured. This is not escaped from the oviduct, so you just have all of this inflammatory tissue at this point. Internal layers may be the result of a number of things, something that has obstructed the oviduct, an infection, perhaps a tumor, and in these animals, partially or fully formed eggs will be found in the abdominal cavity. It's like, how do you get a fully formed egg? Well, you have peristalsis that moves the eggs down through. Sometimes it can get reversed. So you get reverse peristalsis, which pushes almost fully formed eggs back up into the abdomen, giving rise to the name of internal layers or internal ovipositions. Oftentimes you won't find the cause of something like this. This may be associated with a problem known as erratic oviposition and defective egg syndrome, or EODES, which is a problem in broiler breeders, which is accompanied by a number of issues. In addition to internal ovulation or internal laying, you can have oviductal prolapse, a high incidence of double-yolked eggs. And of course, when you have all of these things going on, you're going to have an increased amount of egg peritonitis and mortality. It's thought that you can help to decrease the incidence of erratic oviposition, defective egg syndrome by avoiding stimulation by a lot of light of the young hens too early, and make sure that you are feeding an appropriate ration, not putting on weight too quickly. So lighting and body condition will help to decrease the potential for internal oviposition. Well, you should be able to poke an egg like this. This is a shellless egg. And sometimes animals will pass them without any particular reason. There are a number of conditions, including nutritional problems, viral infections, that can result in the laying of shellless or poorly shelled, maybe wrinkled eggs. We have talked in this lecture, we've talked in previous lectures about the importance of calcium and vitamin D3 in the ration, especially in layer hens. Layer hens may move 10 to 20% of their bone calcium on a daily basis to this developing egg. The egg shell is composed of 90% calcium in the form of calcium carbonate. So there's a tremendous amount of flux in the movement of calcium. So if you don't have enough calcium in the ration, up to 3.5%, you're not getting enough vitamin D3, cholecalciferol, into the ration so the animal can absorb the calcium coming into its intestine. Then it's going to mobilize the bone to an extent that it will be detrimental to the bone, making it fragile, easily broken, and you will have cage layer fatigue or paralysis in your laying hens. Here's some wrinkly looking eggs, not properly made. And you can see attenuation of shell, broken shells, poorly formed shells with a couple of viruses, including infectious bronchitis virus, which we've talked about before as a disease of the upper respiratory tract, lower respiratory tract, and of the kidney. Some strains of this coronavirus can infect any portion of the reproductive tract. So you're going to get not only defects in the shell if it affects the shell gland, but because it can affect other parts of the reproductive tract, you can have a marked decrease in the internal quality of the eggs as well. It's also known to affect shell pigmentation. And so the uniformity in white eggs you're not going to notice, but in brown eggs, the uniformity of the color is going to be effective. So you may see pale eggs up to 5 to 7 days after you have infectious bronchitis come into your flock. The duration of the egg changes may last up to several weeks. Its effect on the magnum will cause watery whites because the virus destroys the mucin-secreting cells, which are located in the magnum. And the keeping quality of these eggs is markedly decreased as well. So not a great thing to come into a large laying facility. Here's some more shellless, poorly shelled, fractured egg shells, and a disease that is caused by a adenovirus of the genus adenovirus. Duck adenovirus 1 results in a somewhat funny sounding name, egg drop syndrome virus. Not egg drop as in egg drop soup or dropping eggs on the ground, but a marked drop in the number of eggs that are produced. Ducks and geese are the reservoir for this particular virus, which can be of economic importance in chickens and quail. So ducks and geese are the natural hosts. They can infect a number of species, including chickens, but antibodies have been reported in many avian species, including owls and swans and guinea fowl and pigeon. So it might not cause clinical disease, but certainly is capable of infection in a wide range of avian species. Egg production in outbreaks usually drops from 10 to 40%. And infected birds usually are outwardly healthy, although you might see diarrhea or mild illness before the changes in the egg quality occurs. Histologically, you can see lymphocytic and heterophilic inflammation throughout the oviduct. Okay, moving on. Here's a couple of eggs that I really don't want to eat. This is Aspergillus, and in hatcheries you're going to have a certain percentage of it's a ubiquitous mold in brooders. We've talked about it in the respiratory lectures as a cause of brooder pneumonia. You can actually infect eggs as well if there is a small hole or something like that, and this is just the mycelia of the mold that is very common in most hatcheries. Hey, do you remember the Meckel's diverticulum? This was described in, I think, lecture 5 of the GI tract, and we said this is where the yolk sac attaches. And here we have what is going to be Meckel's diverticulum. It's usually at the junction of the jejunum and the ileum, and we have an inspissated yolk sac. The yolk sac is one of the 3 temporary structures, including the embryonic membranes, the amnion and the allantois, which are within the egg, and the yolk sac is what supplies food to the developing embryo. The amnion provides protection. The allantois serves both as a respiratory organ. It obtains minerals from the shell to pass on to developing embryo, and it handles wastes, and they function until the time of hatching. Usually the yolk sac is largely gone by the time that the embryo is ready to pip or to hatch, but it is something that can become bacterially infected as well. When it does, the process is called omphalitis, and it's usually associated with unhealed navels, for lack of a better word, in young birds. It's often associated with poor condition. It's not an infectious condition. It's usually one that's associated with maybe poor regulation of temperature or humidity during incubation. Bacteria can infect the navel. It can go up the yolk stalk and infect the yolk sac, not unlike what we see in mammals, especially young foals or calves with navel ill, where you get a infection of the navel and then migration up the umbilical vein into the liver. They could be wet, they could be scabbed over, and you can probably tell me easily the different types of bacteria that you would expect to see: E. coli, staph, some of the other gram-negative Pseudomonas proteus that are omnipresent in the environment are commonly cultured from these particular animals. The animals don't do well. They're usually found dehydrated. They don't have any interest in food and water. It's a septic process. And you see mortality start very close to hatching. It may go on up to 2 days out. 2 weeks out. Here's a normal abdomen from a chick, and a nice hemorrhagic one from one with a yolk sac infection. Don't forget enterococcus as well causes a lot of different problems. We talked about enterococcus as a major cause of vertebral or bone abscesses, and it could be that a lot of those start at around the time of hatching. Okay, let's finish up this lecture and the lecture on birds with, as we always do at the end of the system, we look at some of the neoplasms. And whenever I see poultry with this type of sort of pearlescent neoplasm going through the abdomen, usually starting around the root of the mesentery and moving out until proven otherwise, it is always ovarian or oviductal carcinoma. They have a profound method of growth by carcinomatosis, by explantation. They will affect multiple organs, will cause fibrosis within the abdomen. You'll see them all over. Usually they have a sort of a highly eosinophilic character, the neoplastic cells. And nothing else really looks like it. They're very common in a lot of different bird species. So I would certainly consider that as the number 1, 2, 3, 4, and 5 causes in pictures such as these two. And then finally, seminoma. This is a pigeon. They even though you generally only have one functional gonad, they're a very common neoplasm in bird species, especially pet birds, and they often metastasize. Don't see them too often in poultry because I guess you just don't have as many, don't need a lot of roosters. But you'll see them in male small birds. Females, I tend to go to the renal first, but in males, seminoma's not uncommon in pet bird species. Well, this brings us to the end of this lecture, of this series. As I said before, I've had the opportunity to work with and learn from some amazing poultry pathologists over the years. Dr. Rob Porter, Dr. H.L. Shiva Prasad, Dr. Frederick Herr, and Dr. Dan Shaw, and I know that I'm leaving quite a few out. Dr. Oscar Fletcher. I want to thank them especially for teaching me what little I know about poultry. I don't get to work with it that often as a diagnostic pathologist. There is a reason that poultry pathology is its own specialty. These guys do a fantastic job in diagnosing diseases of amazing economic importance. My interest in diseases of birds and poultry is more out of curiosity than something I get to do on a daily basis. So my hat is off to all of these great poultry pathologists. I highly recommend, if you get a chance to spend time with a poultry pathologist, that you do so, especially some of the ones whose names have come up routinely as contributors to these lectures. They really know what's going on. I will consider myself a dilettante in this field. But if nothing else, these lectures should get their names out so you can find their publications, maybe one day get to meet them, sit in on their lectures, because these are amazing, amazing pathologists. Okay, that covers avian species for me. In future lectures, At the end of this year, I'll be doing some on wildlife, so we'll touch on some of the wild species. Then, for me, Bruce Williams from the Joint Pathology Center and the Charles Lewis Davis Samuel W. Thompson Foundation, thank you so much for listening in. I hope you've enjoyed this, and you'll come back to our Facebook or YouTube channels for lectures on some other animal species that you might find of interest. Take care.